तुमको अपना असेसमेंट भी पता लगा होगा जब मैंने बताया होगा तो।
बिल्कुल सर, बिल्कुल बहुत हेल्पफुल था सर।
एग्जामिनर को लगे कि हाँ भाई ये तो इससे अच्छा आंसर हो ही नहीं सकता, इसको तो देना ही देना है। So very good. You have very good knowledge in your hobbies.
Yes, sir. My mother is very interested. She is a teacher in government school. She is teaching history. So it's her subject also, and she reads the Srimad Bhagavad Puran, Srimad. Since very childhood also, I am getting exposure to these literature. That's why I could develop interest in those, sir.
तो इंटरव्यू आपका आप समझो 60-70% ठीक गया है, मतलब क्योंकि ये वाइवा नहीं है, यहाँ पे ये इंटरव्यू है। तो यहाँ आपको साइकोलॉजिकली भी बहुत अच्छे से एसेस किया जाता है कि आप किस चीज़ से भाग रहे हो, किस चीज़ से आप अनकंफर्टेबल हो रहे हो, डिस्कम्फर्ट हो रहा है, तो उस पर आपको काम करना जरूरी है। यानी आप अपने को खुद ही अपने इंटरव्यू को भी अपने डायरेक्शन में मोड़ सकते हो। अगर आंसर्स है ना, जैसे इंट्रोडक्शन और ये वाई वी सिलेक्टिव, इसको अच्छे से लिखो और रट जाओ। मतलब इसमें क्या है ना, आपका 10-12 लाइन का होना चाहिए और अच्छा सा रटा हुआ हो, ताकि फट 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 आप उसको बोल दो। Welcome to the panel. Please introduce yourself.
Good evening, sir. Myself, Dr. Akhilesh Singh. I am born and brought up in New Delhi. Did my schooling from Navyuk School in Delhi only. I pursued my graduation in homeopathic medicine and surgery from Nehru Homeopathic Medical College and Hospital. And currently, I am pursuing post graduation in practice of medicine from same college. My hobbies include reading religious scriptures and reading other things, sir.
Okay. So you are doing PG in NHMC. What are
Yes,
the
sir.
duties allotted to you in this JR-ship?
Sir, in JR-ship, along with seeing patients, we are also involved in teaching undergraduate students in my subject and as well as other homeopathic subjects also. And besides that, we are also allotted IPD patients, which we need to admit and give them full treatment, their diagnosis, and other things which we are doing, sir.
Okay. What kind of diseases you are frequently seeing in your OPD?
Sir, in our OPD, sir, mostly chronic patients report, such as rheumatological conditions and dermatological conditions. Along with there are also some special clinics which run in our OPDs. So for special gynecological condition and lifestyle condition, respiratory condition, all these kinds of patients come to our OPD, sir.
Can you put more emphasis on that? Means what kind of patients you have seen in your OPD
Sir,
in last 1 year?
Yes, sir. Sir, since my thesis topic is also cervical spondylosis, so I am predominantly seeing this cervical spondylosis patient in osteoarthritis OPD. That's my area of working. Sir, other than that, in general OPD, I also see skin cases and also fever cases like that. Other GI cases also, sir. Gastrointestinal complaints also in general OPD, sir.
So since your thesis is on cervical spondylosis, can you tell me the differential diagnosis of cervical spondylosis?
Yes, sir. Sir, differential diagnosis of cervical spondylosis. Sir, first common diagnosis is migraine also, sir. Sir, in migraine, many patients are having aura with cervical pain. Along with that, sir, multiple sclerosis also might have some features of cervical spondylotic myelopathy, which also come as a differential. Sir, one of the rare differential diagnosis which we should not ignore is a subarachnoid hemorrhage also, sir. In that also, neck stiffness is there and pain is there, but we can differentiate it on the base of sudden onset and that thunderclap headache. These are the main differentials, sir, which I can recall right now, sir.
And what is the difference between cervical radiculopathy and cervical myelopathy? How will you
Sir,
differentiate?
yes, sir. Sir, when only radicals are infringed, where the roots are origin of the nerves, that we term it radiculopathy. And when the muscles are also involved and the end organ symptoms are also muscular symptoms are also there, then we tell it as cervical spondylotic myelopathy, sir.
So what is the topic of your thesis, dear?
Sir, the topic of my thesis is the usefulness of individualized homeopathic treatment in improving quality of life in patients with cervical spondylosis. It is a prospective 1 hour clinical study observational study, sir.
So if you are doing already PG, you are teaching students, means you are engaged and you are earning your stipend also. Why UPSC will give you opportunity to join this job? Since you are already engaged in some work or in PG, why
Yes, sir.
we would offer you to join this job?
Sir, currently I am pursuing my PG, which is about to end in 6 to 7 months only, sir. And besides that, I want to continue my practice in a government setting only, sir, because here in my hospital also I am seeing diverse type of patients from all social strata, which patients are coming, and I am getting the chance to cater them, which I think, sir, won't be that much possible with my private practice. So I want to help the people and cater more number of people in a government setting only, sir. That's why I am here in front of you, sir.
What is the exclusion criteria of your thesis?
Sir, in exclusion criteria, I am excluding all the patients which are having some severe disease or extremes of age, more than 65 years, all pregnant female, and patients on any immunocompromised therapy or other HIV or no patients who are not composed mentis, who are not sound minds. That patients I am excluding, sir. Rest other patients I am including.
This synopsis that rheumatic disease, malignancy, neurological, metabolical conditions,
Yes, sir.
and steroid injections, analgesics, cognitive impairment, all
Yes, sir.
those things are not mentioned by you in this interview, na? You didn't mention that, na?
Yes, sir.
So you should, I mean, you prepare the synopsis, so you should take care of that. That what you have
Okay.
written there, you should remember that also, and you should mention also, na, at the time of
Okay.
interview, because they can
Okay, sir.
open your synopsis also, and they can ask also. So that must be related with that, na? That's why, yeah.
Yes.
And what is the aims and objectives of your this synopsis?
Yes, sir. Sir, the primary objective of my study is to see the changes in oswestry neck disability index before and after the treatment. And secondary objective is to enlist the frequently indicated individualized homeopathic medicines used in cervical spondylosis. That is my secondary objective, sir.
I think why you choose this topic, cervical spondylosis?
Yes, sir. Sir, the primary aim before choosing this topic is, sir, because many patients are there and many studies which I was reviewing on the internet when disease I was seeing. Sir, many studies have been published and case reports which are dealing with the pain management only in cervical spondylosis patients. Sir, but specifically homeopathy, the role of homeopathy in improving quality of life of the patients, that was not available in the existent literature. So, sir, I wanted to explore the limits of homeopathy in improving quality of life in general, which includes pain as a one of a component. That's why, sir, I'm choosing this condition. And moreover, many patients who are continued using NSAIDs and all, they report to our OPD. They are willing to quit these allopathic medicines. So that's why large number of patients are also available, sir.
So you born and brought up in Delhi, na?
Yes, sir.
So why Delhi is famous for?
Sir, Delhi actually became the capital of free India in 1910 when Delhi Darbar was happened. And from Calcutta, the capital of India was shifted to New Delhi. Besides that, it is our national capital territory, sir, of national significance, of international significance. Our president resides here, our prime minister resides here. Sir, many of the well-known healthcare facilities, including AIIMS, Ram Manohar Lohia Hospital, Lady Hardinge Hospital, from which internationally patients are coming, those are located in Delhi only, sir. And besides that, many historical monuments are also there in Delhi, like India Gate, Red Fort, and all that.
Reliable resources regarding epidemiological data of Delhi. What are the diseases prevalent in Delhi? Means you have
Yes,
to
sir.
tell on the basis of some resource.
Yes, sir. Sir, exact data I am unable to retrieve right now. But sir, as far as I could see from my OPD experience and from the news and all which I hear, sir, those diseases which are known to be the prevalent diseases in urban areas like dengue, malaria, chikungunya, these diseases become very popular among this rainy season and before that. Sir, besides that, being an urban city, the prevalence of diabetes and the prevalence of dyslipidemia and all those lifestyle disorder is also very high in Delhi. So currently I am not having exact data about the percentage of the diseases. but that's what I see in the OPDs only, sir.
In your introduction also, what you told about your hobby?
Sir, reading religious scriptures and spending time with my family members.
Reading
Sir.
religious scriptures. So, which is your favorite religious scripture?
Sir, Ramcharitmanas.
Ramcharitmanas. Okay. Written by
Sri Tulsidas, sir.
Goswami
Tulsidas.
Tulsidas ji. Okay. So how many chapters are there in the Ramcharitmanas?
Sir, 7 chapters are there.
7 kand is there.
7 kand are there, yes, sir.
Acha. Okay. So which is your favorite?
Sir, Balkand.
Balkand. And it's very big also, no?
Yes, sir. That is very big part also.
So can you recite any chopai from the Ramcharitmanas?
Yes, sir. Sir, I can recite the very first chopai from that. That is Pandam Gurupad Padum Paraga Surichu Subha Sarasan Raga Amya Murime Churan Charu Saman Sakal Bhavruj Parivaru Sukriti Sambutan Vimal Vibhuti Manjur Mangal Mood Prasuti Janman Ranj Mukurmal Harni Kiye Tilak Gun Gan Bas Karni. Sir, that is the full verse.
That is the full one. Okay. So what it mean?
Sir, it is basically here Goswami Tulsidas is praying to his guru for giving him ability to write such literature on such a great character like Ramchandra ji. So he is worshipping his guru only.
Okay. You know the difference between Doha and Sortha also?
Yes, sir. Exact grammatical differences, sir, I am not knowing, but as far as I could tell, if Sortha is pronounced in by changing the lines, the second part put first, it becomes a Doha. That's what I can remember, sir.
So can you remember any Sortha also?
Sir, Sortha, exactly, I am unable to recall right now.
No issue, no issue.
Sir, I am remembering. Bandhon Gurupad Kanj Kripa Sindhu Nar Rupari Mahamohatam Punj Jasu Bachan Ravi Karnikar. Sir, if we reverse this, it will become a Doha.
Yes. Very good. Excellent. And what other scriptures you also about apart from Ramcharitmanas? What other
sir,
scriptures?
Srimad Bhagavad Gita, sir. Srimad Bhagavad Gita. Yes, sir. So
do you remember any slok of Srimad Bhagavad Gita?
Yes, sir. I could remember the shlok which was said by Sanjay that yatra yogeshwara krishno yatra partho dhanurdraha tatra shri vijayo bhutir dhruva nitir matir mama.
So it is written in which
it is in sir 18th chapter, the last chapter, 18th chapter, last shloka, sir.
And which one is first?
Sir, first one is Dharma Kshetre Kurukshetre Samveta Yutsva Mamaka Pandava Shaiva Kim Kurvanti Sanjaya. Sir, that's the question which Dhritarashtra is asking to the Sanjay.
Kurvanti nahi. Kim Kurvat Sanjaya.
Kim Kurvat Sanjaya, yes, sir. Yes.
Aage?
Sir, exact I am unable to recall.
No issue. Dharma Kshetre Kurukshetre Samveta Yutsva Mamaka Pandavascheva Kim Kurvat Sanjaya.
Yes, sir.
Drishtvadu Pandavanikam Vyuram Duryodhanastada Acharyamupasangamya Raja Vachanam Abravit.
Yes, sir.
Kind of going on.
Yes,
so it's very nice that you remember that also. So I think you are impressed with the philosophy of Gita also in your life.
Yes, sir. Yes, sir.
So can you give example, or you can can you give some example or correlate it with your life?
Sir. Yes, sir. Sir, Gita basically gives the philosophy or the teaching of Karma Yoga. Sir, whatever we do in our daily life, we should never be Nishkarm. Nishkarm is restricted from Gita. We should do all the things which are to be done as suggested by our Dharma, and we should not wait for the result to come or desire any specific result for that. We should do as suggested by the Dharma and go on doing our karma, and the benefit of that or the result of that should be left to the God. Whatever he finds good for me, he will give it to me, sir.
And what is Sthit Prajna?
Sir, Sthit Prajna is the person who has he's restricted all his senses from various sides. His vision, he's only devoted to God. His hearing ability is only listening to the scriptures of God. His tongue is only singing the bhajans of God, sir. He is not diverted towards various diversion.
He will do his work or not?
He will do his work, sir. Yes, sir. Yes, sir. He will do his work, but devote all his work to the God, sir.
Means he should be same in each and every condition. He will
Yes,
not
sir.
be sad in the sad moments or not happy in very enjoyable moments. Like सुख दुख
Yes,
के
sir.
समय कृत्वा लाभालाभ हो जाया जयो, है ना?
Yes, sir. Yes, sir.
So,
Yes, sir.
so
Yes, sir.
he must be in the
That's the definition.
balance in every state and each state of life, है ना?
Yes, sir. Balance. Yes, sir.
हाँ.
Yes, sir.
So very good. You have very good knowledge in your hobbies, and since you have written in your form also that you are interacting with your family members, so other family members were also interested in this religious
Yes, sir.
things.
Sir, my mother. Yes, sir. My mother is very interested. She is a teacher in government school. She's teaching history. So it's her subject also, and she reads the Srimad Bhagavad Puran, Srimad. Since very childhood, also I am getting exposure to these literature. That's why I could develop interest in those, sir.
Very good, very good. Have you seen the COVID patients also?
Yes, sir. Actually, in my COVID period, I was posted as an intern in dispensary of Delhi government in Delhi Secretariat. So majority of mild patients which are having only upper respiratory symptoms like coryza and pharyngitis and mild fever, those patients used to come to dispensary. That patients I was seeing, sir. I was intern at that time, sir, when COVID time was there.
So which medicines you have used mostly in that
Sir, mostly.
in due course?
Yes, sir. Yes, sir. In arsenic album, Restox, Bryonia, Gelsemium, these medicines were frequently indicated, sir.
अच्छा, अच्छा. Okay. You मतलब if it were frequently indicated, huh?
Frequently indicated.
So did you means you were involved in any article writing or any article during your tenure of your internship or during your PG study? Are you involved in any article? You publish any article in peer-reviewed journal?
Yes, sir. Sir, in peer-reviewed journal, I have yet not published any article, sir, but one case report on scalp folliculitis I have submitted for review in the IJRH.
Did you study other articles if when you have taken this cervical spondylosis topic? Did you read any
Yes, sir.
other articles also? Can you refer here 2-3 articles with primary author, secondary author's name?
Yes, sir, sir. Sir, one study by was K. Kumaraswamy. He is a professor in Sarda Krishna Homeopathic Medical College in Karnataka. Sir, he used LM potencies in the management of cervical spondylosis and got very good results with that, which is published in the IJRH. Sir, one of the study conducted by the CCRH also, that was a multi-centric study at 3 regional centers in Noida and one in South India. I'm exactly unable to recall the location. So they also proved the efficacy of certain bowel nosodes in the management of cervical spondylosis pain. Sir, and one case report was published by Nisha Gopinath, who was using this individualized medicine along with these biochemic medicines, and she got very good result in managing cervical spondylosis. That's what I can remember right now.
Why would we select you for the post of medical officer? So what will be your reply?
Yes, sir. Sir, the first point will be that the main thing which I think is required for a physician, any physician, and though that too specifically being posted in a government setting, is the empathy and compassion. Because sir, patients from various social strata, majorly being poor, they come to the government setting for healthcare needs. So that quality, sir, I think I am having of empathy and compassion. So that quality will be useful in providing the healthcare services to the most needy, which come to the government sector. Sir, besides that, the financial strength which we the stability which I'll get in the government sector, that will be at par, at when I will be working at certain other place also, sir. So this ability of catering large number of patients along with my financial stability would be the main things which I think you should consider, sir.
Okay, thank you very much.
Thank you, sir.
Your
Thank
interview
you
is
so
over.
much. Thank you, sir.
अब इसको हम एनालाइज कर लेते हैं, ठीक है?
हाँ जी, sir.
तो इंटरव्यू आपका आप समझो 60-70% ठीक गया है। मतलब एक तो आपका जो है ना कह सकते हैं कि जो आप रिप्लाई कर रहे हो कॉन्फिडेंटली कर रहे हो। बस उसमें क्या है कि कुछ क्वेश्चंस में आप तुरंत भाग जा रहे हो आंसर देने से। वो थोड़ा-सा आपको वहाँ पे पकड़ के रखना है क्योंकि वही आपका फोर्टे है, वो एरिया है, जहाँ पे आप कर सकते हो।
Yes, sir.
इंट्रोडक्शन आपका ठीक था, इंट्रोडक्शन पोर्शन वाज़ गुड, उसमें कोई दिक्कत नहीं है। उसमें इसको देख पा रहा हूँ कि तुम्हारा कमांड हॉबीज़ पे ठीक है, तो तुम बोल सकते हो। बट जनरली क्या होता है, लोग हॉबीज के बारे में बोल देते हैं, उसके बारे में जानते नहीं है ज़्यादा। तो इसीलिए वो तो तुम्हारे लिए स्ट्रॉन्ग पार्ट है। अगर अच्छा, दूसरी चीज़ जो है आपसे पूछी ना कि ओपीडी में पेशेंट्स कैसे देखते हो, क्या देखते हो? तो आपने वो जैसे लाइफ़स्टाइल डिसऑर्डर फलाना-ढिमकाना वैसे नहीं बताना है। उसमें क्या है ना कि उसमें लगता है कि फिर आपको आप देखते नहीं हो पेशेंट, या इस तरीके की एक भावना आती है। तो यू शुड मतलब स्टेट की डिज़ीज़ वाइज़ की अगर आप सिस्टम भी बोलते हो तो उसमें डिज़ीज़ गिनवाओ। लाइफ़स्टाइल डिसऑर्डर लाइक डायबिटीज़, हाइपरटेंशन, थायराइड या स्किन डिजीज़, तो फिर इसका एक्जिमा, सोरियासिस चीज़ जो आप समझते हो उचित, या जो आप वाक़ई देखते हो जिनकी फ्रीक्वेंसी ज़्यादा है, उसको
यस सर।
अच्छे से पढ़ो और उसको मेंशन करो प्रॉपर्ली। क्योंकि ये वाइवा नहीं है, यहाँ पे ये इंटरव्यू है। तो यहाँ आपको आपको साइकोलॉजिकली भी बहुत अच्छे से असेस किया जाता है कि आप किस चीज़ से भाग रहे हो, किस चीज़ से आप अनकम्फर्टेबल हो रहे हो, डिस्कम्फर्ट हो रहा है। तो उस पे आपको काम करना ज़रूरी है, यानी आप अपने को खुद ही अपने इंटरव्यू को भी अपने डायरेक्शन में मोड़ सकते हो। अगर आपको पता
यस,
होगा कि ये डिजीज़ पूछेंगे, तो आप पहले
यस
से
सर।
पढ़ के रहोगे डिजीज़ और करके रहोगे, तो आपको ये रहेगा कि आप उस पे ही खेल लोगे, उसमें 15 मिनट खींच लोगे उनको। तो अच्छे से 10-15 डिजीज़ का अध्ययन करके जो जनरल प्रैक्टिस में आते हों, वैसे भी आते हैं ना हमारे यहाँ तो एनएचएमसी में।
यस सर।
तो उसको आप
जनरल ओपीडी।
अच्छे से पढ़ के तैयार करके फ्रॉम साइन सिम्पटम्स टू क्लिनिकल फीचर्स टू इन्वेस्टिगेशन टू क्लिनिकल एग्जामिनेशन टू थेरेप्स टू ऑल उस डिजीज़ का आपको सब पता होना चाहिए। उसका दाएँ-बाएँ सब। सर्वाइकल स्पॉन्डिलोसिस का तो होना ही होना चाहिए। बाकी आपको जो 8, 10, 15 डिजीज़ हैं जिसको आप बताना चाहते हो कि ओपीडी में आप देखते हो, उनके बारे में आपको पूरा ज्ञान होना चाहिए। तो ये फिर
यस
आपका
सर।
थोड़ा, क्योंकि वो बाद में आपसे पूछेंगे कि क्या-क्या मेडिसिन दी जा सकती है उसमें। तो आपका वाइवा थोड़ा मतलब इंटरव्यू थोड़ा अच्छा चला जाएगा। मान लो आप सोरियासिस पे पड़ गए हो, तो सोरियासिस की
यस सर।
5 मेडिसिन आप में 5-6 मेडिसिन आपको पता है। फिर उसका डिफरेंशिएशन आपको पता होना चाहिए कि आप इससे इसको कैसे डिफरेंशिएट करोगे। तो
यस
उससे
सर।
क्या होगा कि आपका मतलब एक इन डेप्थ नॉलेज इसमें भी पता लग जाएगा। आंसर्स है ना, जैसे इंट्रोडक्शन और ये व्हाई वी सिलेक्टिव, इसको अच्छे से लिखो और रट जाओ। मतलब इसमें क्या है ना, आपका 10-12 लाइन का होना चाहिए और अच्छा-सा रटा हुआ हो ताकि फट-फट, फट-फट आप उसको बोल दो। फाइनेंशियल स्टेबिलिटी बार-बार नहीं बोलना है। मतलब एक आध बार बोल दो और उसको बार-बार नहीं बोलना है। बिकॉज़ आपके पास ऑलरेडी इतनी चीज़ें हैं ना, आपके तर्कश में इतने तीर हैं ना, आपका कंटेंट इतना अच्छा है बोलने का कि उसमें फाइनेंशियल स्टेबिलिटी की बात करोगे तो कहेगा कि ये तो इसका मतलब मेहनत नहीं करना चाह रहा है प्राइवेट में।
यस सर।
तो एक बार बोल दिया ठीक है कि फर्दर इट विल गिव मी फाइनेंशियल स्टेबिलिटी एंड इट विल means I will not think about my bread and butter, and I will only focus on uh, my duty, since I am
पेशेंट केयर।
research oriented person also. So I can easily do my research projects also after joining this job. So further I can uh, mm, enhance my enrich my system also in homeopathy. रिलेटिव एक आंसर अच्छा सा 10-12 लाइन का बनाओ, इसमें सारी चीजें इनकलकेट हो जाएं और फिर आपका आंसर एक बेस्ट आंसर बन के निकल के आए, जिसमें इमोशनल एंगल भी हो, लॉजिकल भी हो, और मतलब आपको एग्ज़ामिनर को लगे कि हाँ भाई, ये तो इससे अच्छा आंसर हो ही नहीं सकता। इसको तो देना ही
यस
देना
सर।
है।
यस सर।
और सबके आंसर ऐसे नहीं बनवाता हूँ मैं, सबके अलग-अलग होते हैं, सबकी स्ट्रेंथ, सबकी वीकनेसेस अलग होती है ना। तो
यस
आपकी
सर।
स्ट्रेंथ क्या है, उस पे भी वो भी थोड़ा-सा उसमें डाल दो, अगर कोई आपकी स्ट्रेंथ आपको लगती है। तो
यस
ओवरऑल
सर।
ठीक रहा, अब इन चीज़ों को इम्प्रूव करोगे तो और अच्छा निखर के आएगा। हाँ ना बेटा?
यस सर।
प्लस एक चीज़ और देखना, हाउ यू कैन रिलेट होम्योपैथी विथ प्रैक्टिस ऑफ मेडिसिन, बिकॉज़ यू आर डूइंग योर पीजी। So how home practice of medicine will help you uh, in your homeopathy? तो इसको भी एक बार देख लेना, बिकॉज़ दे कैन आस्क कि भाई आप तो कर रहे हो पीजी प्रैक्टिस ऑफ मेडिसिन में, तो होम्योपैथी में क्या हेल्प करेगा? या होम्योपैथी में प्रिस्क्रिप्शन में कैसे ये हेल्प करता है? तो फिर वही तुमको अपना असेसमेंट भी पता लगा होगा जब मैंने बताया होगा तो।
बिल्कुल सर, बिल्कुल बहुत हेल्पफुल था सर।
हाँ, तो इसलिए अब जो है उस पे काम करो और उस पे हम देखते हैं, आगे बढ़ो, ठीक है?
नेक्स्ट। यस सर।
बस उम्मीद कुछ नहीं करना, अपना काम करो।
यस सर। गीता।
हाँ, गीता, बिल्कुल।
थैंक यू सर।